Edaravone, also known as Radicava, is used to treat a specific type of nerve disease called Amyotrophic Lateral Sclerosis, ALS, which is also commonly known as Lou Gehrig's disease. It is not a cure for ALS, but it can help slow down the progression of the disease. It does not reverse nerve damage or muscle weakness. The recommended daily dosage of Radicava oral suspension is 105 mg per 5 ml, and it is typically taken twice a day. It is best to take Radicava at the same time each day, with approximately 12 hours between doses. Taking it consistently at the same time every day can help maximize its effectiveness. Before you start using Radicava OR's 105 mg per 5 ml oral suspension, it's important to read the patient information leaflet and instructions for use if available from your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth or through a feeding tube on an empty stomach as directed by your doctor. It is usually taken in the morning after not eating overnight, which means at least 8 hours after a high-fat meal, 6 hours after a low-fat meal, and 2 hours after a calorie supplement. Do not eat or drink, except for water, for at least 1 hour after taking your medication. For the first treatment cycle, this medication is usually taken once daily for 14 days, followed by no Radicava ORs for 14 days. After that, each treatment cycle is usually scheduled as Radicava ORs taken once daily for 10 days out of a 14-day period, followed by no Radicava ORs for 14 days. It's important to follow your doctor's instructions carefully on how to use this medication. Remember to shake the medication well before using it and to carefully measure the medication using the provided dose measuring syringe. Do not use a household spoon because you may not get the correct dose. It's important to use this medication regularly to get the most benefit from it. To help you remember, mark the days on the calendar when you need to take this medication, and use it at the same time of day each day that you are scheduled to take it. You may experience bruising, problems walking, tiredness, or headache while taking Radicava OR's 105 mg per 5 ml oral suspension. If any of these effects persist or worsen, it is important to notify your doctor or pharmacist right away. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. Although it is rare, a very serious allergic reaction to this drug can occur. Seek immediate medical help if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not an exhaustive list of potential side effects. If you notice any other effects not mentioned here, it's important to contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects, or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada at 1-866-234-2345. Before starting Radicava OR's 105 mg per 5 ml oral suspension, make sure to inform your doctor or pharmacist if you have any allergies, especially to sulfites such as sodium bisulfite. This medication may contain inactive ingredients that can cause allergic reactions. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have asthma. And before undergoing any surgery, let your doctor or dentist know about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, this medication should only be used when clearly needed. It is important to discuss the risks and benefits with your doctor. It is also uncertain whether this medication passes into breast milk, so be sure to consult your doctor before breastfeeding. As for the daily dosage and optimal timing, follow your doctor's instructions carefully. This medication is typically taken orally, and the dosage will be determined by your healthcare provider based on your medical condition and response to treatment. Take this medication at the same time each day for the best results. If you have any questions or concerns about the use of Radicava OR's 105 mg per 5 ml oral suspension, be sure to talk to your doctor or pharmacist for more details. When taking Radicava oral suspension, it's important to be aware of potential drug interactions. These interactions can affect how your medications work and may increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products. Share this list with your doctor and pharmacist to ensure the safe use of Radicava. Do not start, stop, or change the dosage of any medicines without the approval of your doctor. It is important to follow your doctor's guidance to ensure the safe and effective use of Radicava oral suspension. If you or someone you know has overdosed on Radicava ORS 105 mg per 5 ml oral suspension, and are experiencing serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911. If the symptoms are not as severe, you can also contact a poison control center for guidance. In the US, you can call 1-800-222-1222, and in Canada, you can reach out to your provincial poison control center. It's important not to share this medication with others, as it is prescribed specifically for the individual's condition. Your healthcare provider may also conduct lab or medical tests while you are using this medication, so it's crucial to keep all scheduled appointments for monitoring your progress and ensuring the medication is working effectively for you. If you happen to forget a dose, just skip the missed dose and take your next dose at the usual time. Avoid taking an extra dose to make up for the missed one. Make sure to store the bottle upright at room temperature, away from light. Once you open the bottle, make sure to use up the medication within 15 days, or within 30 days from the date it was shipped, whichever comes first. It's important to keep all medications out of reach of children and pets. When it comes to discarding the medication, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, make sure to properly discard the product when it's expired or no longer needed. If you're unsure about the proper way to dispose of the medication, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.